we had no family. Things happen. But that being said, now it's important for y'all to remember that because we think of our cultures and we have to pay attention to specifics and follow what their preferences are, their cultural preferences are. And if we do have substitutes of medications that we can use, oh, well, let's use them. And certainly, if we knew what we knew, we would have called the doctor and said we are not able to give this blood because he's Jehovah. What else can we do? And the doctor might have said, you still give it. I mean, could have, or said, let me have the phone number to one of those family members. But see, at the time we didn't have any contacts. It was just a strange situation. Plasma expanders, those too can be used. Talk about the Hess band. Then you see all these different preparations of IV bags, right? I call it the baby IV bag, the 25. I don't see those too often anymore. Probably costs too much money to manufacture those 25 milliliter bags. Responsibilities of the IV nurse. You must inspect the container and determine that that's a solution that's prescribed by the physician. It's clear and transparent. The expiration date's not elapsed. There's no leaks. And separate labels for when pre-added medications that you have to inject in there. Maybe you have to put an amp of vitamins, multivitamins in the bag. Maybe they send it up like that and with the amp of multivitamins, and that's your responsibility to add it. Typically now pharmacy adds everything.
If you do add it, will that label tell you how long it's good for? Like just like a precipitate out, or I don't know. Give you a new shelf
Typically once you inject or you instill a solution, that bag is good for 24 hours. And you need to change the bag 24 hours. These are the things that you might need in order to start an IV or to add solutions. You have your connecting tubing that y'all are familiar with seeing that, right? IV tubing, the spike where it goes into the bag, right? You have clamps, and you see you have a clamp here on this extension tubing that would connect right to the IV side, but you also sometimes have these clamps on the IV tubing itself. The roller clamp that regulates the IV. Different access ports that you will see along the IV tubing. Macro drop, micro drop. Macro, large, it could be any drop. It could be 10 drops per milliliter. It could be 12. It could be 5. It could be 8. Macro. Micro, it's got, and this one, I don't think you can see it, but inside right here, there's like this little wire. And it calculates, and as far as I have ever known, in my time as a nurse, the micro drop is equated to 20 drops per milliliter. 60 drops per milliliter. 60 drops per milliliter for the micro drip. 60. You might have on your ATI pharmacology that asks the question, it's asking about how many drops per milliliter. And it says the tubing is a micro drip, but it won't give you that number. And if that was to happen, you would assume that that's 60 drops per milliliter. A macro, that's that first one, macro, they have to give you that factor. They have to say, you have a macro tubing and it's 12 drops per milliliter. They have to give you it. No question. This last one is how the blood tubing looks. You see it with wides, and they have a filter system. You have a 250 cc saline that you spike on one side, and then of course the blood be on the other. Okay. Drop factor. I just went over all this with you. Drop factor is meaning you're manually regulating the IV, right? You're using that regulator, that roller device to regulate it. Does it make sense? I have to be able to count my drops to know how fast I'm going to run this IV. This is infusion rates, meaning I'm using a pump. When I use a pump, I walk into the patient's room and the pump is set up milliliters per hour. I have to dial in. The doctor wants 1,000 milliliters in 8 hours, continuous. How fast do I need, when I walk into that room and I spike my 1,000 cc of normal saline, what do I need to set that pump at? 125. Is that right? 125 milliliters an hour. He wants 1,000 milliliters over 8 hours, continuous. You take that 8 divided into the 1,000, you get what? 125. That's the infusion rates. A pump, an IV pump, milliliters per hour. Drops per minute has nothing to do with an IV pump. That's two separate animals. Do y'all concur? Y'all understand that? Because a lot of people get them mixed up, trying to start mixing them. Those are some infusion devices, depending on what the hospital uses. I use that example. It's an easy example. I guess that's why I use it. But do you see what you do? You're walking into that patient's room. Oh, I've got to give this IV 1,000 milliliters over 8 hours. I have to punch in 125 for the rate. For the volume to be infused, it's going to be 1,000 milliliters. It makes sense, doesn't it? It makes sense. It has to make sense to you. Now, we're talking about using the regulator on the tubing, drops per minute. You have to read the package, the IV tubing package, to discover what that drop factor is. I have it out in my car. I should have brought it today, but I showed some of my students what the tubing bag looks like. It had a drop factor on it. It had a little teardrop, and it had something like 10 in it. That's what you look for. Whatever your hospital uses. How that works is you can use them, whatever that tubing is they use for the pump, you can also regulate it by hand as well. You can. So all in all, you look at that tubing package, discover what they're saying their drop factor is. Again, for macro drop, they've got to give you the number. Micro drop, 60 drops per milliliter. How do you calculate this stuff? I have an order of 1,000 milliliters to be given over 8 hours. 1,000 milliliters divided by time in minutes. It's 8 hours. How many minutes in an hour? 60. 8 hours times 60 minutes equals what? 8 times 60, 480. So you got 1,000 divided by 480 times whatever that package says is the drop factor. Whatever it is. And that will give you your drops per minute. A drop either falls or it doesn't fall. Right? You can't tell me, you can't give me an answer of 21.3 drops per minute, because what am I going to do? I'm gonna mark it wrong. If it was 22.5, what would that be?
23?
23.5.
Oh, you said 23.5, so it'd be 24.
Well, whatever.
Oh, okay.
22.5.
It'd be
I'm trying to say that 0.5 rounds it up to the next whole number,
Yes, ma'am.
right? But if it was 22.4, what would it be?
22.
22. A drop either falls or it doesn't fall. Now, I will tell you, in some pumps, when we're going back, think back to the infusion rates. Some of these IV pumps do carry their infusion rate out 1 decimal point. So I could have a pediatric patient and I have to give a solution of something, and I can dial in 30.2 milliliters an hour. 2 different animals, right? But I want y'all to understand how that could be. Well, you said we didn't do decimal, but I said that's right. It's a whole number for an IV drops, because a drop either falls or it doesn't. But for a pump, if they tell you they've got a specialized pump that carries it out to the decimal, first one space that passed, you know, the 10th, then you would put that number in. Does that make sense? But most of the time, you guys won't see those special pumps. They usually reserve those for the neonatal ICUs, and in some cases they might have them in the ICUs, but on the med-surg floors, you just have those pumps that have the whole number, milliliters per hour that you dial in. But that's how you can get yourselves mixed up. Say, well, you said the drops, you have to have whole number. I said, that's right. But there are some pumps, when you're piping in milliliters per hour, that you could carry out to 10th decimal point. So there it is. There's your calculation. The tubing said that it had 20 drops per milliliter. And I wish I could see a tubing somewhere, but I don't see one there. It's the package the outward package of the tubing. So 1,000 milliliters divided by 480 minutes. I put the milliliters in the minutes so y'all understand where I'm getting these numbers from. Times the drop factor from the tubing equals to 42 drops per minute. And 42 drops per minute tells me what? What is that? If I regulate 42 drops a minute, what is that going to equal to in terms of how fast that solution's going? How fast? How fast? If I regulate that tubing to 42 drops a minute, what that's doing, what that's telling me is I am following the doctor's order. He wants that IV to be infusing at 125 milliliters an hour. Does that make sense to you? He wanted 1,000 over 8 hours. In order for me to do that,
You
and
get
I
42 drops.
got to go
in 8
42
hours.
drops a minute. And I just break it down. Oh, he really wants 125 milliliters an hour. Isn't that what he wants, guys? Does that make sense? This has got to make sense to you. It's a simple formula, but people freeze on it. Maybe it's taught a different way. This is the way it was taught to me, and it's so simplistic. You just have to remember rounding. You can't do a fraction. If you put on your ATI test 42.3, you're going to miss it. You know, if it rounded out to a fractional number, you got to go to, if it's less than 0.5, it goes down. If it's 0.5 and above, it goes up to the next whole number for drops per minute. Does it make sense? All right. One other thing might be on your ATI is talking about the height, the typical height of the elevation. Because it's gravity. We're not, if it's working off of a pump, that's a different thing because it's the pump that's making that run, right? But gravity, typical elevated height, 14 to 24 inches. Yes.
So if a patient pulls with that roller clamp,
Oh yes. Oh, yes.
I've done that.
Yeah. Oh, you play with your, yeah, oh, yes. You're absolutely right. Kent, that's why you would never, repeat after me, I will never
I will never
hang
hang
potassium chloride,
potassium chloride
IV,
IV
unless
unless
it's on
it's on
a pump.
a pump.
How do you think that they execute these death row people? How do you what do you think they do? Yeah, that's what they do. Yes. Okay. Potassium kills the heart. Remember the sodium potassium pump? That potassium goes in and just stops that heart. Remember I told you about the dialysis patient that could barely crawl into the ER because they decided to enjoy their Thanksgiving and not go to dialysis treatment. They decided that they would skip, and then they can barely get themselves into the ER, and they hook them up and their heart's just barely beating. And they do a serum potassium check, and whoa, it's like 7.2. We're getting ready to arrest here because they haven't had their dialysis treatment. That's what it does. It starts at the, excessive potassium stops the heart. So don't ever, if you have 1,000 milliliters of D5W with 20 milliequivalents of KCl in it, and you have Dallas as the patient, see, he played with the roller clamp. See what I'm saying? Because he didn't know, he could have, see what, but they wouldn't have done that. They wouldn't have put that, they would have put it on a pump. Y'all see the dangers. But they probably just had you some plain Ringer's lactate and you played with it and all you had to do is do excessive urination. This is a joke. But seriously, see the dangers of, and hence, that's why you'll see some of these nurses, they have them in the med room, they'll create these tapes and they'll mark the IV bag with time because they want to make sure, because they'll be doing these hourly rounds, they want to make sure that that thing's clicking along the way it's supposed to. That way we can catch Dallas when he's playing with his, regulator, right? Because it's either going to be all in or it's going to go in a lot faster, right? Makes sense, right? But that's why you do at least every hour rounding. And you're supposed to do hourly rounding on your patients anyway, because you don't know what can happen. Patient's IV can infiltrate during that hour. You don't go back for 8 hours, you've got you a nice sized basketball. Painful. And there's different venous angiocast sizes. I like the 24 gauge if I have a preference, but that won't do for that blood transfusion, right? On ATI, most likely you've got to identify 18 gauge. 18 gauge. I just tell you that if push came to shove, you could use a 20 gauge. But 18 gauge is what NCLEX is looking for and what ATI would be looking for. 18 gauge. If it says the minimum gauge, you just say 18. That's what they like. Painful.
It doesn't look anything like how you pronounce it.
Okay. veins in the hand and the forearm are used most commonly because you start at the bottom and work your way up. You start distally and work your way up, right?
It'll come to me later.
I don't like it when you're.
I know. I know y'all don't. So I've got to show y'all this. I've got to show y'all this video. It's awesome. You won't have this here.
In Pendango,
Yes.
I'm getting closer. It's gonna hurt me. Wow. We're looking that
What
up.
does that mean? What do I need to do? Oh, I'm not gonna be able to do
In Pendango.
it. It's played on mine. They're not gonna let me download. You guys watch it on your home computer.
Okay.
I was very impressed that this school allowed, it's the same concept with the Salem Sump. Started ID.
Oh.
Y'all have to look on yours. It's-
Let her in the session. They're doing too much on each other.
Here's a,
You could hook it up to Chrissy's laptop.
oh, okay.
Do you want to?
I don't know, y'all wanna see it? Y'all wanna see that? Y'all have a, that, see quite well. Y'all wanna see it? You can maybe, can I hook it right back to mine? I'll let y'all handle that. Thank you, Chris. Compliments of Chris for y'all's viewing enjoyment. But I think it's good for y'all, and see, y'all want to hang on to this because, I mean, maybe there's some minor hiccups that they did with their technique. But the essence of capturing how to start the IV, I think it helped is valuable, very valuable.
Pause it. HDMI should be in the back. Where your laptop is.
You can tell. Oh, okay. Well, he tried, and it wasn't successful.
Is that what this is?
But you guys have the capability of watching this.
Okay.
I think,
On YouTube.
I think it's good. It's a good video. It's good video, guys. I can't believe nursing school allowed this, but they did, so, you know, that must be someplace up in North Dakota, they're wilderness that they allow things, you know, erratic things, that's all
They
right.
can't get funding in it.
That's all right. But the value of just the essence of it.
What the heck is gold? Just gold? Just big gold salt?
Basically, guys, here's the Venus system where you would choose to access. I will tell you. Well, this is the anesthesiologist's thing. This is the one they frequently go for.
It's like pain somebody will closing you.
I don't like starting IVs on the inner aspect of the arm or the wrist area. I just think there's too many nerves and too much potential damage. I will tell you, I have found plenty virgin veins. I call them virgin veins. See how these spread out to the fingers? Sometimes that's all you've got left because a lot of nurses, they don't think to use those. And if you're in a crisis where you're just trying to get a 24 gauge to get them some fluids because they're so dehydrated, you'll do what you got to do. The ER likes to do those anticubicals. They send them up like this, one in each arm. And then, of course, every time they put their hand up to their mouth to take a bite, you know, of their meal, the IV pump goes off because it's right there at the end.
That's what they should put in their nose.
Try to avoid that if you can.
You should put in your nose.
Try to, yes. These are the equipments that you would typically use or gather. You know how you gather your equipment. There you go. In a one flash, you can say, yeah, that makes sense. This, and this. See how that makes sense? They now have this ChloraPrep that they have in the IV kits that's much better. And hospital-wide, in most hospitals, they've gotten away from even the alcohol preps in these kits.
I don't know what you want to buy to it, but I think you should just go there.
You can look at this for when you do Adult Health 1, save this, right? You'll have a better understanding of when you gotta do that high-stakes test. This is a high-stakes test in Adult Health 1, starting an IV. See, you'll know all the equipment that you should get. Makes sense, right? It's omitted in your fundamentals, isn't it? That's not reading. But I said, no, I gotta share this, because I know what's coming at you. Yeah. No, it's not really Mr. Moore, and that's not really me. But I wanted the image, right? It says grasping at the mattress there. Grasping. He's very tense. That facial expression looks awful worried. And then all it is a 24 gauge. Just this little point. But you see the concept. See that C? You see how they made the C? You can see it off to the distance here. They use the C. You got the flashback. You see the flashback, and they floated that right into the vein. It's right there at the hand. See that, right? That's what you're looking for, is that flashback. What you guys might need to know for your fundamentals is the complications that ensue with IVs. Infiltration, for instance. It will be a slowed or stopped grip. It'll be swelling at the site. It'll be uncomfortable. It'll be cool to touch. You have to stop and DC the IV. Stop it and DC it. You have to start another. Much like on the other arm. Unless they have a dialysis catheter. See how things can happen. If they have a bovine graft, can you start on that arm? No. You have to still work with what you got. That's where you call the doctor and say, you know, we need a PICC line certified nurse to put a PICC line in. Or can we consult and get a PICC line inserted by a radiologist? Things like that. Because you have these situations. So you elevate the affected arm on a pillow to allow that fluid to reabsorb into the body. Does that make sense to you? Yes. But you got to DC it. And don't try to think that that's just going to magically come back. It's not. Phlebitis, swelling redness, warmth, discomfort along the line of the vein. You can actually, sometimes you might even see a streak. You might be able to palpate a cord on the vein, a cord of lumps, what I'm saying, right? It will demonstrate a sluggish rate flow. It will be, patient will have an elevated temperature. This is more serious. More serious. This patient might have to end up having to get antibiotic treatment, potentially. Again, your immediate actions to stop the IV. DC it. You have to restart another one. Notify the physician. Initially, cold compresses. Initially. You have some situations that could occur with patients that have central lines, for instance. I've had patients that's developed thrombosis as a result of having a central line in place.
How do you know they have thrombosis? I mean,
You start seeing the swelling, it's sluggish, and then what happens is you picking up on this stuff, they confirm with radiology tests. And then that's a mess. You got to get the physician needs to get that out quick, because that's in a major vessel. See, because the embolus is one that travels, right? We got a chance here. We can stop if we can do correct